The problem we have is that unhealthy diet is one of the top risk factors for death and disability in the world. And unfortunately, the food system we have does not provide the right food and the right nutrients to all people in the world. So you have this double burden. On the one hand, you have over 40 million children who are still undernourished and 150 million who do not grow well, and still you have 50 million children who are overweight, and then you have a lot of children who are adolescents who are overweight. And this is because our diets are unbalanced. This is because we have an excess consumption of sugar and fat, and also because the lifestyle doesn't allow to make up with the excess energy with adequate physical activity.
Francesco, whilst the debate, if I may say, over the role of fats and different fats is still open, of course, your big concern, I think, for you would be something like trans fat. The debate about sugar seems to be unambiguous. Too much sugar is creating fat children, fat populations, diabetes problems, and a whole host of other bowel-related problems as well. Isn't it time, and I'm not a fan of big government in many, many ways, but isn't it time for more tax on sugar across the globe?
Well, there's time for action. And it's time for companies to reconsider their products to bring down the sugar content. And this has to be incentivized by government initiatives. Consumers have to be enabled to choose the right products by having clear front of the pack labels. That is happened now in South America or in some European countries. But clearly, price policies are extremely helpful, increasing the price of products which should be discouraged, and actually incentivizing decreasing the price, for example, of fruit and vegetables, and making it available to all would be extremely helpful. But also remember, the governments are often number one consumer, number one purchaser of food in schools, hospitals, army barracks. If governments could only buy certain products with health properties, then we would have an entirely redesign of the food system.
Looking at some of the stats in Africa, the number of overweight children under 5 has increased by nearly 50% since 2000, and nearly half of the children under 5 who are overweight or obese in 2016 lived in Asia. Isn't this telling us about an emerging market frontier crisis that's evolved? Some of these countries used to be somewhat poverty-stricken or not really even in the middle class, therefore access to nutrition and food was an issue. The crisis has now evolved as cheap foods made its way into these countries and people have moved up the income ladder. Is education part of the mix here, that these parts of the population are simply not educated in what is the right mix of food?
I don't think it's a matter of education. It's a matter of access and availability of food. You're right in saying that actually the highest rate of overweight in children under 5 are in North Africa and in South Africa, even more than in Oceania, even more than the Pacific Islands. And this is because the availability of certain foods, I mean, often soft drinks are the rules, and even are an ambition, and they're extremely cheap. So it is a matter of making the healthy food more accessible, bringing down the prices of those foods, and making sure that the access, the distribution in the system is adequate of the healthy food. I mean, you often find in small shops in low-income neighborhood in many of these African or Asian cities only the products which actually should be discouraged. You find a lot of confectionery, you'll find a lot of soft drinks, and that starts very early in life. Even children under 2 are often given biscuits, are often given fruit juices, and it starts very soon to have an unbalanced diet.
What's the World Health Organization relationship like with the big sellers of these sugary products, the big consumer products groups, the ones especially, I guess, related to candy and sweets and confectionery as well? Do you see them as public enemy number 1, Francesco? If not, why not?
Well, I don't think we have to speak in this way. I mean, the enemy number 1 of the World Health Organization is the tobacco companies. We have a constructive dialogue with food and beverage companies. I mean, certainly what we criticize is the attitude some of the companies have is to discourage legislation particularly in low-income countries. But we have a frank dialogue with them. We are basically raising certain expectations. We are suggesting certain targets, for example, for the reformulation of food products. We are asking them to bring down the sugar content, to remove industrial trans fat, to bring down the saturated fat, and to bring down the salt. This is something which can be done. And actually, there are some companies in the food system, transnational or even local, which have taken this challenge and have responded positively. But in some cases, this is not happening. So WHO is clearly speaking up and is also suggesting that while it's good that companies take action voluntarily, it is important to create a level playing field, and governments should therefore set up a number of policies to persuade companies to act in that direction.
Hey everybody, it's Hadley Gamble from our new CNBC Middle East Bureau in Abu Dhabi. Thanks for stopping by. Now to watch more, you can try one of the videos that just popped up on your screen. And don't forget to subscribe.